75 years, at least to me, represents essentially a human lifetime or thereabouts. And in other ways of looking at it, it's 3 different generations. Generations about 25 to 30 years. So we have folks that not only have been born here, but maybe their grandkids have been born here as well. Well, I'm David Ratcliff. My title is I'm the Chief Medical Officer at Washington Regional. Well, when I came here in '91, I looked at really a number of places within the state because I wanted to come back to Arkansas. And to me, hands down, Fayetteville was the place to be. And that's because of some of the pioneers and my predecessors that had established the forward-thinking healthcare that we had here at Washington Regional. Individuals that came here in the 50s, 60s, and 70s, and also a lot of civic leaders as well, who joined hands with the providers here and said, we're going to have a wonderful community hospital. Initially, we served our city, then we served our county, and now we're serving the region. And that's something that's been embraced not only by a lot of strong medical leaders, but a lot of civic leaders as well. So when I saw that, to me, I went, where else would I want to raise my kids? Where else would I want to practice medicine? And 34 years later, I've never regretted it. North College, I thought was a wonderful hospital, but we had really kind of outgrown our space at that point. So in 2002, we came here to our area out in North Hills. So we've seen a tremendous amount of growth. In fact, when we first started in North Hills, we were about 350,000 square feet. We're now close to 800,000 square feet. So the area has grown, the city has grown, and our hospital has grown as well. Plus, we're not a corporate hospital. The management, the board of directors, and all the folks that work within our system all live here. That means we get to make the decisions of what's most important for our community and for our patients and for the way we practice medicine. I think that while it's not unique, it's rare, and it's certainly unique in our region. I think that our time during the pandemic is the time that I am most proud. At a time when all 3,500 members of our community, of our hospital community, our system community, pulled together quickly, effectively, efficiently, and we hit the pandemic head on. We provided wonderful care for our community. In fact, the mortality rate from the pandemic in Washington County was 1/4 of what it was around the rest of the country. And I don't think that was by accident. I think it was because we hit it quickly, effectively, and with great expertise, and we continued to focus on it for upwards of 2 years to make certain that we had a good handle on how we were providing care to the community. Our governor came up to Washington Regional the first week when the emergency was declared to say, the rest of the state, see how Washington Regional is doing it, because that's what you need to be doing too. And so, yeah, I was really proud of that. Northwest Arkansas is growing about 8 times as fast as the rest of the state. And with that growth in population comes the need for expanding healthcare services. And the best way to do that is through training, not only graduate medical education for physicians, but all forms of healthcare, our nurses, our technicians, our therapists, our support staff. We have decided and we have become an academic medical center, and the only one really within the region that has the capacity to do so. But I want to thank our staff for the passionate way that they provide care. It's clear that we're neighbors taking care of neighbors, and that's what I want to thank our staff most about. So everyone at Washington Regional, congratulations for 75 wonderful years.